Behavioral Neuroscience, Chapter 13, Segment 4. Our homeostatic mechanisms defend a set value for weight. Golden-mantled ground squirrels gain weight seasonally when food access is normal, and if body fat is surgically removed, they will eat until they regain it with remarkable precision. Almost 65% of the adults in the United States qualify as overweight, with 1 in 3 qualifying as obese. These categories are based on BMI, or body mass index. Epigenetic transmission is the passage of epigenetic modifications of a gene from one generation to another. This may affect the offspring of an obese parent. Interestingly, most obese people have higher levels of leptin than do thin people. Leptin appears to regulate endogenous cannabinoid levels in the hypothalamus. There are currently no drugs used to modify the functioning of the hypothalamic appetite system, but drugs that are cannabinoid antagonists might help. Rimonabant, which interferes with CB1, effectively reduces appetite and feeding behavior, but unfortunately also has a depressant effect. Drugs can also be designed that target some of the signaling systems integral to the arcuate appetite controller. Lorcaserin activates serotonin receptors found on many POMC neurons and produces modest but significant weight loss. Spraying a PYY336 solution into the mouths of lab mice powerfully suppresses their appetite. Another approach is to raise the body's metabolic rate and expend calories in the form of heat. Thyroxine increases metabolic rate, and scientists are trying to mimic this in the form of a drug that does not cause side effects like thyroxine. Increasing the activity of brown fat is also a possibility because it contains thermogenin, a specialized protein that allows mitochondria to turn energy directly into heat. Hormones, drug treatments, and environmental manipulations can all induce the formation of beige fat cells that resemble white fat but express larger numbers of thermogenin containing mitochondria. It is found throughout the body and also has the potential to burn excess stored energy at a high rate. Another approach is to interfere with the formation of white fat tissue by blocking the process of angiogenesis, the formation of fat by adding new blood vessels. Blockade of a signaling protein that normally stimulates angiogenesis, known as VEGF, effectively inhibits the growth of fat tissue in mice. Orlistat works by interfering with the digestion of fat, but also causes intestinal discomfort. Drugs that affect the brain's reward circuitry for food may prove beneficial for weight loss. Liposuction is popular, but generally only moderately successful. Bariatric is having to do with treatment of obesity. Gastric bypass surgery is proving to alter appetite hormones such as ghrelin. Implantation of inert weights in mice has tricked the body into believing it is heavier than it is. Anorexia nervosa is a syndrome in which individuals severely deprive themselves of food. The name of the disorder indicates that it is in the nervous system and patients have no appetite. It's common in young girls who usually become obsessed with their body weight and have a distorted body image. They become very thin, generally by eating very little, and sometimes vomiting, taking laxatives, over-exercising, or drinking large amounts of water. Food stimuli still provoke a large release of insulin, but there is cognitive denial. AGRP levels are abnormal in women with anorexia nervosa, which indicates that the hypothalamic appetite system may be abnormal in this condition. Twin studies indicate that a predisposition to anorexia nervosa is heritable. It's difficult to treat, but family-based treatment is often effective. Bulimia is a syndrome in which individuals periodically gorge themselves, usually with junk food, and then either vomit or take laxatives to avoid weight gain. People with bulimia may believe themselves to be fatter than they are, like people with anorexia nervosa. The patient's lack of nutrient reserves damages various organ systems and leaves the body unable to battle otherwise mild diseases. Binge eating is the paroxysmal intake of large quantities of food, often of poor nutritional value and high in calories. In susceptible people, the strong pleasure associated with food activates the opiate and dopaminergic pathways to an extent that binging resembles drug addiction. Mutation of the MC4R receptor is associated with binge eating, so people with this mutation may be failing to receive the signal to stop eating. Eating disorders could be caused by the modern belief that one must be thin to be beautiful, but these disorders existed even in the Renaissance, when it was considered better to be plump. Gut microbiota is the microorganisms that normally inhabit the digestive tract. The microbiome is the collective term for the population of microbes found in the gut. The enterotype is each individual's personal composition of gut microbiota. It reflects dietary history. Evidence has linked the microbiome to mood, anxiety, cognitive functions, and various disease processes. Earlier exposure to antibiotics can play a role in the onset of obesity. A fecal transplantation is a medical procedure in which gut microbiota via fecal matter are transferred from a healthy donor to a host.